my name's Nicholas Parkhill. I'm the CEO of ACON, formerly the AIDS Council of New South Wales, and we provide services to HIV positive people, to gay men, and to members of the lesbian, gay, bisexual, transgender and intersex community. In relation to the services that we provide for HIV positive people, importantly we provide an early diagnosis service. So if someone has been diagnosed HIV positive and they come to us for assistance or support, we're able to get back to them within a 24-hour period and provide them with service. That's really critical in terms of people having that support in those early days of a diagnosis. Other than that, we provide ongoing counselling for people who are positive to assist them at various stages, whether they're newly diagnosed or been living with HIV for a few years, or indeed whether it's a long time. We're able to provide that support service and counselling program for positive people. We also provide counselling for gay men in relation to prevention. We often know that gay men can go through a difficult time, as can anyone, and so our counselling and support really is able to assist them when they're going through that kind of challenging time, particularly around steps that they can take to remain negative. In addition to those one-on-one peer supports or counselling supports, we also provide, if you like, more peer-led initiatives. We run a program called Genesis, which is a multi-week group run over weekends, where positive guys who are relatively newly diagnosed, within 2 years of being diagnosed, come together over a number of weeks on weekends and really talk about what that means, what it means to be HIV positive. So issues get covered up such as treatment, when to start treatment, what a positive diagnosis means in kind of negotiating sex and disclosure, what it means to disclose your status at work to your friends, to your family. Those really important issues that some people can struggle with a diagnosis, but done in a peer way. So that's a really important program, but what it also does is help provide or build a network of peers and a friendship group, or a group where social inclusion is just as important. Other initiatives that we do is we run an annual Treatments by the Sea, where we bring positive people together and really talk about the latest developments in treatment and what they mean for people's health. As well as other developments around healthcare and what that means, particularly for positive people. And we also provide an Aboriginal retreat for positive Aboriginal people, and they can come together, talk about treatment, talk about implications for being positive for them individually, but also what that means in their particular cultural context, which plays out in a very different way and a very sensitive way. So it's incredibly important for those people to have that space to come together, to be able to discuss that and continue to build those peer networks. We also provide a meal service once a week here in Sydney to positive people, and once again it's about building up that social inclusion. There's a lot of people that do it tough when they're living with HIV. The meal service really allows people to come together for a free meal here in Sydney, and it really addresses some of those issues around social exclusion or loneliness. All of ACON's programs for HIV positive people are free of charge. So in terms of financial barriers, there aren't any financial barriers, and so all of our programs are free of charge for positive people in terms of access. So people access our services in a whole range of ways. Often people will be referred in by their treating clinician, and they will refer them to an ACON program, whether that's counselling or one-on-one support or the Genesis program. People also come to us through the website. We have a page on our website where you can write to us with your issue and we'll get back to you. people can call, make a phone call, and we'll respond. Particularly, as I said, for those newly diagnosed people who have just received a diagnosis, we will get back to you within 24 hours, whether you come in via the website or email us or call us. We'll get back to you within that 24-hour period. We do provide statewide services, so we would be able to provide telephone counselling or online counselling, or if there was an issue where it was somewhat critical, then we do have an outreach team, so we could provide that level of service if that was required. So just because someone's not in Sydney or an area where we have a service doesn't mean that we're not able to provide assistance or support.